going to go over some respiratory fit test kit hygiene. The fit tester should wear a mask, wash hands and or hand sanitize with 70% isopropyl alcohol, then don disposable gloves, discarding after every test. All fit test equipment should always be thoroughly inspected before use and should be discarded if it shows any signs of damage or wear. During the fit test, use the same hood for a subject that was used during the sensitivity test for that subject. Use one set of nebulizer for each subject being fit tested. And any clogs in the nebulizer, once you open it up, can be cleared. And there in the kit comes this little tool. Once in a while there will be crystallization. You can just put that, replace that. And so you'll either use pre-saturated towelettes from a dispenser, and all 3M approves any of the chemicals on the EPA N list for the novel coronavirus. And it also suggests, instead of squirting the disinfectant inside the hood, so we only have to do the inside where somebody was breathing, is to saturate the paper towel. And then thoroughly wipe all the internal surfaces down. And depending on the cleaner you use, and the N list will also specify the contact time to kill the virus. This one happens to be 60 seconds. So once we're done doing all the surface, being sure to get the corners, you want to leave that sit for 60 seconds so that the kill time is effective. And you also discard towels after each use. So the inside of the hood and the outside of the nebulizer. And you can also use pre-moistened towelettes. And just go around the outside that was actually in the hood while the test subject was inhaling and exhaling. And again, you let that dry for 60 seconds. Place it on a clean surface. And after the minute is up, you can dry the inside in the same fashion. Paper towel. You want it to be completely dry before storing it or reusing it. And if it's still a little bit damp, you can go ahead and use a hair dryer to blow in there until it is completely dry. And then you can either fold it up and store it back in the kit that it came with, or if you don't have a kit, I like to use large Ziploc bags. And then you have to be careful. You gently roll it up. Place the bag, seal it, and then that way we know this one's been disinfected and ready to be reused. Careful not to crush it when you store it. Okay, thank you.